Many of us have experienced headaches, but when it comes to migraines, what should you be aware of and how can you effectively manage them? Newswatch 16's Carrie Kearns has the answers in tonight's Healthwatch 16 report.
Healthwatch 16, sponsored by UPMC, life-changing medicine.
Headaches and migraines can both be debilitating, but what sets them apart? Medical experts at UPMC say with headaches, individuals can typically continue their daily activities, while migraines often leave them unable to function.
So they're typically one side of your head, and they typically alternate sides. They're throbbing and pounding in character. They have light and sound sensitivity associated. And sometimes patients can also report having nausea and vomiting as well, but typically more nausea than vomiting.
Suhag Patel, a physician assistant and neurology expert at UPMC, notes that a family history of migraines is a significant risk factor and various exposures can trigger them.
So sometimes the patients that mentioned to me, if they're driving and the sunlight's coming through the trees, that strobe effect can trigger a migraine. Sometimes chocolate and wine can do it. So if you love chocolate or wine, that might not be your best interest if you have triggers. And then environmental factors, strong smells, weather changes.
While many patients resort to over-the-counter pain medications for relief, Patel cautions that excessive use might do more harm than good.
There's a phenomenon called medication overuse headache, which used to be called rebound headaches, where if you take anything for pain, whether prescribed or over the counter, more than 2 or 3 days a week, you can actually have worsening headaches in terms of frequency and severity. And then any medicines that either your primary care provider or even us in neurology try to treat you with, they might not necessarily work as effectively.
So when should you see a doctor for help with migraines? Patel says you should seek medical attention in the following situations.
They're over the age of 50 and they've never had a headache before. Typically something worthwhile to get checked out. If someone is immunocompromised or if they have a history of cancer and they develop headaches, that's another what we call red flag symptoms. If someone who has had headaches their entire life and then all of a sudden have a change in their symptomatology, that's another reason to get looked at for headaches.
Healthcare workers say there are multiple treatment options available for migraines, but the best approach depends on the individual's preferences and the frequency of their headaches. For this Healthwatch 16 report, Carrie Kearns, Newswatch 16.